Many patients ask me, do I get penile lengthening done? Do I get penile girth done? Or do I do both? Well, it depends on your priority. Let's assume for a moment that there's budgetary concerns. You say, well, what's more important, length or girth? I will tell you that girth is far more important than length, assuming that you're not very short. Let's say, for example, you're 3 inches long in erection. That's a problem, right? We want to get you consider getting to 5 inches, right? That would be more of a priority. But most men are at least 5 inches or greater in erect length. So let's put that aside and say, well, if you're an average person with a penile erect length of, let's say, 5 or 6, the suggestion is girth all the way. Okay, for example, if you had 2 or 3 procedures for the girth increase, you'll go from, let's say, an average of 5 inches in girth to maybe 7 or 7.5 inches in girth. Now, why is that important? And why is that much more important, as it comparing to length and so forth, is that when you have intercourse, the clitoral nerves actually branch into the vaginal space, right? So if you have a larger girth heading into the vaginal space, you're kind of rubbing against those walls. I say wall-to-wall coverage, so to speak. So when you're entering into the vaginal space, you're stimulating those nerves that are riding along there, and that's like almost equivalent to having oral sex, but with your penis, okay? So that's how powerful it is. So if, again, you had to balance this out, whether it's economics or time off of work, whatever, girth, 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 period. That is the priority number 1.